It's week 2 of the summer of surgery. We're at our favorite place.
Yay.
Today, the stitches come out, and we have our first injection. Yay. We've had an interesting week. I guess it was Friday or Saturday. Patrick woke up with his head really red and swollen. I was keeping a really strong face for him, but inside I was panicking because, as many of you know, the whole reason we're going through this whole process is because Patrick already had an infection. And so I got on the phone with the doctor and I texted her pictures of his head. And she said it shouldn't look that red. He starts the antibiotic, and then we're at church on Sunday. And it occurs to me that Friday, we laid on the patio. Right. I sunblocked his whole self. I blocked the sun from his self. Except.
Duh.
I burned his skin. Awesome job. So I called the doctor. I'm like, hey, I don't think it's an infection. I think I burned his head. And she's like, well, we can't be too sure. So now he's on the antibiotic just as a precaution. These drives to Cooper are not Patrick's favorite thing. We're going to do it, though. Okay. We're going to go. We'll talk to you guys later. Is that Patrick? That's gauze.
I think it...
These look like the syringes that are going to go into your head. I wonder what the pen's for. It's a skin marker.
Oh, she's going to
mark your skin.
First then
needle to the head.
Yeah.
Alright, so we're just taking out the stitches now. And
it doesn't hurt as much as I thought it was.
No.
Your face looks like it hurts.
Well, I'm getting the knots right now, so they pull a little bit. Once I get the knots out, the rest of it will come out easily.
Don't move your head, sweetie.
Ow.
What?
What hurt?
You alright? Sore there?
Oh.
That side is still sore, yeah.
This whole side.
Yeah. It'll get better.
I'm not being a bastard, but it's just kind of like...
You're not. It's not fun.
Okay, that stitches out also. Okay? So you're all set as far as that goes. No more stitches. Now,
is that what they look like?
What?
They're kind
the
of
stitches,
cool.
the blue?
They're kind of cool
yeah.
looking, man.
Yeah, you never saw that they were blue?
And we'll start slow. And then you'll feel some pressure when I put it in. It shouldn't be bad. If it's really feeling too tight, I can take some out. Okay? Today, I'm not putting in much at all, so I don't even know if you'll feel it much. Okay, turn your head a little to the side here. Now this lump here that's the port, and that's where we're going in. So the needle's pretty small. It's smaller than you'd use when you draw blood. So, ready? 1, 2, 3. It's in. Okay, that's the only part that's really. It's just the needle.
Wow,
right.
Wicked sci-fi right now.
And so I'm putting in the fluid. And today I'm just putting in 5 cc's, which is not very much at all. Ready? 1, 2, 3. It's coming out. So that's tissue expander number 1 and tissue expander number 2.
That actually didn't hurt at all because isn't there an actual thing in there? You
yeah,
can stick
that's the
in
port, right? And this is where your port is on this side. Ready? 1, 2, 3. It's in. Okay. And then we're going to inject this one too. 5 there. And coming out. And we'll get a Band-Aid on that.
You're awesome, Patrick.
And they'll feel a little firmer. Now, these aren't at all firm. What I would like to be able to do is to fill them to the point where they're firm, because then they're actually stretching the skin more. But first time around, I don't want you to be stressed at all with it. Okay. So that's what you can expect, okay?
What did it feel like?
It's semi-painful.
Semi-painful? But what was painful? What part?
The whole thing? If you fucking rip these things out.
That hurt.
That hurts the most.
How about could you feel the needle going to your head?
No. I could hear it.
You could hear it.
Could
Weird.
Could you hear it?
No, I couldn't hear it. That's crazy. That's crazy.
Well, like, you know what it sounds like when it comes out of a faucet?
Yeah.
It's like liquid coming out of something.
Mm.
Or does liquid make a sound when it goes in something?
I don't know. PSA, public service announcement. This dude right here, this one with the face, and the head, and the Band-Aid on said face and head, is a freaking warrior, man. You just achieved gold star status, warrior. Like, you were already a warrior. No, you had gold star status. Platinum status, yo. He's got platinum status. Once he goes through the final process of cranioplasty after all this, I don't even think they'll have a name for the type of warrior he is. I gotta get this guy home. See you guys next week for week 3, summer surgery. Peace.